This is the lecture for Chapter 6, Digestive System. If we chew a piece of food and track where it goes, we're going to start with the path of digestion. So we are going to have the food go through or into the mouth. The teeth will be used to grind the food. The tongue will maneuver the food as well. And then the food will pass down through the esophagus into the stomach. So we've got the food starting here, down into the esophagus, and this J-shaped structure is the stomach. It will then pass into the small intestine, which is this area here, and then travel through the large intestine, the ascending, transverse, descending colon, and then out through the rectum. Accessory organs of the digestive system are the liver, the pancreas, and the gallbladder. The functions of the digestive system are to provide the body with essential water, nutrients, and minerals. It completes the mechanical and the chemical breakdown of foods for absorption by the cell membranes. It eliminates waste products from the body, such as feces, and it includes accessory organs for digestion and absorption of nutrients. The absorption of the nutrients primarily occurs in the intestines. Accessory organs of the digestive system. This is the liver. It's located in the right upper quadrant. Here is the esophagus coming down, emptying into the J-shaped stomach. This little green guy peeking out here is the gallbladder. And then here are the small intestines, and again, here is the large intestine. The liver then is the largest glandular organ in the body. It weighs approximately 3 to 4 pounds and is located in the, if you remember from the abbreviations, RUQ stands for right upper quadrant. So in the abdomen, the right upper quadrant. The liver stores vitamins, produces bile, and it destroys old red blood cells. It's also important in maintaining the glucose level in the blood, and it produces proteins which aid in clotting. The pancreas and the gallbladder. The pancreas provides a hormone, insulin, along with digestive juices. And the gallbladder stores bile that's needed for digestion. Pathology that we see of the gastrointestinal system. One of the most common problems that we see are ulcers. Ulcers are in the gastrointestinal tract. Mostly they're seen in the stomach and the first part of the small intestine known as the duodenum. The ulcers are an open sore on the skin surface of the mucous membrane. There are different types of ulcers. Peptic ulcer is a common type of ulcer found in the digestive system, in which it's just an open sore in the lining. Now, these can be chronic or they can be acute. A chronic peptic ulcer would be ulcers that are long-lasting, so they go on for a prolonged period of time. An acute ulcer then would be of sudden onset and short duration, where we can put the patient on medication, we can get the ulcer healed, and they no longer have a problem. Now, the difference between a peptic ulcer and a perforated ulcer is a perforated ulcer is much more severe because instead of it just being a sore in the lining of the mucous membrane, it actually produces a hole in the wall lining of the GI system. So what happens in these patients once they have the ulcer is the gastric juices and the acid that are needed to break down the food sit and kind of congregate on that ulcer and that sore. And so if you think about having like battery acid on an open wound, it's just going to continue to eat at that wound. And so that's what happens in the stomach. If this goes on untreated for a prolonged period of time, it can end up with a perforated ulcer, which then produces the hole. If that happens, then stomach contents can leak into the abdominal cavity, and that can be very, very problematic. Another type of problem that we see in the gastrointestinal system, but most specifically with the lower GI, is ulcerative colitis. With ulcerative colitis, this will cause the patient to have diarrhea, bloody bloody diarrhea, bowel movements. They can have anemia where they have lost enough blood through the stool that they no longer have enough blood. And they have arthralgias. Algia means pain, and arthur means joint. So they have pain in the joints with this. Now, most of the time we see ulcerative colitis in young females. That's the most common place that, or the common demographic that we see it in young females who are type A personality, very high strung, very controlling, that they are perfectionists, and so many times that type of personality will manifest itself into a problem in the GI tract, whether it be an ulcer or ulcerative colitis. A hernia then is protrusion of an organ, tissue, or structure through the wall of the cavity in which it's naturally contained. So in your book on page 136, they showed the different types of hernias, and I also have the hernias, you can't see them very well here, but this one is a hiatal hernia. A hiatal hernia is when the portion of the stomach comes up through the diaphragm and that slides through that diaphragmatic opening. With the hiatal hernia, stomach acid can back up into the esophagus, causing heartburn, chest pain, and swallowing difficulty. So the next one is an umbilical or umbilical hernia. And this one occurs, as you can see, at the belly button region. With an umbilical hernia, it's a protrusion of part of the intestine that comes through the abdominal wall, not to the outside of the body, but it goes through the muscular lining. And so it's common in obese people and those who have had several pregnancies. It can happen with patients who have had abdominal surgeries where that's weakened the wall, the muscular wall, and allows a portion of the small bowel to protrude through there. And the last type of hernia that your book talks about is an inguinal hernia. An inguinal hernia then occurs down in the groin region, and this can be associated with heavy lifting. And so basically, again, the small intestine is pushing back through the abdominal wall, and they will have pain usually with this type of hernia. As time passes, pressure in the abdomen against the weak abdominal wall may increase the size of the opening as well as the size of the hernia lump. Now, with all of these hernias, as long as there's good blood flow to the area, and if the patient's not really symptomatic, we're going to leave them alone. However, in the case where, and specifically the umbilical and the inguinal hernia, if the bowel pushes through the opening and it gets pinched off by the abdominal wall, it can cause death or necrosis to the tissue, and that's going to require surgery to do repair of that, and that would be a hernioplasty. Bowel obstructions. Bowel obstructions are seen in patients after they have surgery. The bowel becomes sluggish because we've been inactive. There's two types of bowel obstructions. It doesn't happen in just surgical patients. It can happen in other patients as well. But the first type of bowel obstruction is called volvulus, and that's when the bowel twists on itself. And so if you think of the colon as a tube, and I always use the demonstration of I take my sock off, and I think of my sock as my colon, and I twist my sock, and so the portion where it's twisted is where the obstruction occurs. So feces is traveling down the GI tract, and it gets to the point where it can no longer go further because the bowel has twisted. The other type of bowel obstruction is known as intussusception, and this is where part of the bowel slips into another part just beneath it and causes a telescoping, just like if you had a telescope that you were looking out at the stars and you were done looking at the stars and then you push the telescope together to compact it. That's what's happening with intussusception. The bowel slips into another part or telescopes on itself. If these problems are not fixed or they aren't resolved, that can be very problematic for the patient. They can end up in the hospital and require surgery. Hemorrhoids are internal or external enlargement of the veins in the rectum. And so these can be internal or external, where internal hemorrhoids are an inflammation of the veins inside the body, and external hemorrhoids are when the veins are actually on the outside of the rectum. They're still attached, but they are on the outside, and it makes it problematic for patients when they have bowel movements to keep their rectal area clean. They can become problematic in that they cause a lot of itching, and they can bleed, which can be problematic for patients. Typically treated with sitz baths, stool softeners, preparation H, suppositories, that type of thing. If it's an advanced problem of hemorrhoids, then typically a hemorrhoidectomy or removal of those hemorrhoids externally is required. Liver disorders. Jaundice is a liver disorder in which the bile duct is blocked and bile enters the bloodstream, turning the skin yellow. Two conditions which could cause jaundice would be cirrhosis and hepatitis. For this, the skin turns yellow, but you also see that there is yellowing of the white portion of the eye in advanced stages of jaundice. Diverticulosis is a very common problem that we see in patients age 50 and over, and that is a condition in which there are small little, blister-like pockets that form on the colon walls. And so if you look at it, these little pockets that are forming here, this is a very advanced case. Usually don't see quite this many. And so it's like a little dip or a little pothole like in the road where food can get trapped in these. And with age, our body just tends to make these for some reason. And the problem comes when food becomes trapped in those little outpouchings. And the things that the type of foods that get trapped are corn, peanuts, any kind of nut, any kind of seed, corn, anything we can't digest very well. And it gets stuck in those little pouches, and then the patient develops diverticulitis, which is inflammation of those diverticular pockets that causes an extreme amount of abdominal pain. Oncology that we see of the gastrointestinal system. Stomach cancer is very rare in the United States. It's usually seen more so in regions of have poor food preservation. But colon cancer is very prevalent in the United States. Signs and symptoms of colon cancer: a patient may have a change in bowel habits in as much of maybe they are regular, have a bowel movement every day, and then they start to become constipated, or it may go the other way where they're having more frequent bowel movements. There could be passage of blood and mucus in the stool, rectal abdominal pain, anemia, which is a loss of blood, weight loss, or an obstruction or perforation. Terms that you need to know between pages 140 through 144. The first term, anorexia. Anorexia is a lack or loss of appetite resulting in the inability to eat. Now, this is not to be confused with anorexia nervosa, which is an eating disorder. So we've all had anorexia at one point in our life. If we were sick with maybe the flu, when we didn't feel well and didn't feel like we had an appetite and weren't eating. Appendicitis is inflammation of the appendix, usually due to an obstruction or an infection, and that is usually requires a surgery to remove the appendix. Cachexia is a term that is used to describe physical wasting of a patient, including weight loss and muscle mass. And we see this commonly with AIDS and cancer patients where they get the really drawn in look, like sunken eyes, and their cheekbones are really prominent. Dysphagia, then, is an inability or difficulty in swallowing. So sometimes patients will have problems swallowing with different conditions. Hematemesis is the next term, and that just means there's vomiting of blood from bleeding in the stomach or the esophagus. So this can happen when a patient has a peptic or a perforated ulcer. Malabsorption syndrome is a symptom complex of the small intestine characterized by impaired passage of nutrients, minerals, or fluids through the intestinal villi into the blood or lymph. We will see this as a diagnosis more and more due to patients who have had gastric bypass surgery, because in that gastric bypass surgery, they will change the routing of the intestines so that less portion of the intestine is used in the digestive process. So these patients will have malabsorption syndrome because the vitamins aren't absorbed through the colon where they normally are. Melena is passage of dark-colored tarry stools due to presence of blood altered by intestinal juices. Obesity is an excessive accumulation of fat that exceeds the body's skeletal and physical standards. And it's usually an increase of 20% or more above the ideal body weight. And then the last term, peristalsis. Peristalsis is the progressive wave-like movement that occurs involuntary in hollow tubes such as our esophagus and our colon. Medical, surgical, and diagnostic procedures from pages 144 through 149. You need to know bariatric surgery, which I just spoke about just a little bit with the malabsorption syndrome. It's a group of procedures that treat morbid obesity. So this could be gastric banding, it could be Roux-en-Y gastric bypass. There's several different types of bariatric surgeries, but basically it's used to treat a patient who has morbid obesity, more than 100 pounds overweight. The term colostomy on page 146 is creation of an opening of a portion of the colon through the abdominal wall to the outside surface in order to divert fecal flow to the colostomy bag. So a patient that has colon cancer perhaps may end up having a colostomy. And so the bowel movements actually occur onto the anterior surface of the abdomen, and they have feces that collects in the colostomy bag. A polypectomy is an excision of a polyp, and they show a picture of that on page 146. Sometimes in the interior lining of the colon, polyps, or these little growths, I kind of think of them as warts almost, will start to occur, and this is as part of the aging process as well. And so during a polypectomy is when a patient is undergoing a colonoscopy where they've put a lighted instrument into their rectum and passed it up through the colon. And if they see one of these little growths, then they can do a polypectomy, which is basically surgical removal of that polyp. And the reason why they do that is because polyps are known to potentially convert into a cancerous process if it's left there for a period of time. A gastrointestinal endoscopy is visual examination of the GI tract using a flexible fiber optic instrument. And you can see a picture of that on page 147. They show a colonoscopy where they take a lighted instrument. It's a big long tube, and they pass it through the rectum, up through the anus, and then go the full length of the large intestine for a colonoscopy. And that's where we can see if there's any bleeding, ulcerations, tumors, polyps. This is also where we can see if a patient has diverticula pouches. Upper gastrointestinal series, or a barium swallow, is where a patient goes and has, they are given a barium drink to, it's a chalky liquid that they drink down, and then they take x-rays of the esophagus, stomach, and the small intestine as the barium flows through that upper GI tract. And the reason why this is done is to identify or diagnose tumors, ulcers, obstructions, and that type of thing. Spelling words for this chapter: oral, glossectomy, rectocele, proctologist, dyspepsia, hepatomegaly, appendectomy, enteropathy, postprandial, and hepatomegaly. Important abbreviations to know for the quiz from page 151. GERD, which stands for gastroesophageal reflux disease. In your textbook, it has a little bit of a typo there. If you look, you can see that GERD should be paired up with gastroesophageal reflux disease, and GER is just paired with gastroesophageal reflux. GI stands for gastrointestinal. IBS stands for irritable bowel syndrome. PUD stands for peptic ulcer disease. And R/O is a very common abbreviation that you will see used to mean rule out. So in a diagnosis line, you may see sore throat, rule out strep throat. So they know that patient has a sore throat. They want to rule out the possibility of strep throat. You are responsible for memorizing the word elements and their meanings on pages 131 through 134. So again, this is where you're going to continue to add to your flashcards. Make sure that you're going through those and that you're memorizing those terms, because you will see them again on the midterm. Several of your quiz questions will be from the word elements. This ends the recording for Chapter 6, Digestive System.